Hi everyone, and welcome to this explainer. Listen, if you're tuning into this right now, chances are you're standing on the edge of what's literally one of the biggest medical journeys a person can take. And hey, I totally get it because I was standing right where you are not that long ago. Today, I'm going to be your guide from the other side. I want to share my own personal story along with the actual clinical data to show you what life is truly like after a lung transplant. We're going to step out of that scary unknown and look at a really structured, hopeful, and clearly defined future together.
I remember being on that waiting list vividly. The physical toll is just brutal, and that daily uncertainty, it's heavy. But the one thing that kept me going was wondering, what will my daily life actually look like 6 months from now? So let's take a collective deep breath and look at the real-world evidence of the incredible changes waiting for you on the other side.
All right, let's dive into Section 1, the waiting list journey. So before we talk about recovery, we really have to acknowledge the reality of the wait. Being on the organ waiting list is this wild, intense mix of profound anxiety and incredible hope. Actually, when experts were recently discussing the Crown Princess of Norway's potential transplant, they hit the nail right on the head. They perfectly captured this paradox that I lived through. It's a last resort. Basically, you're asked to be significantly ill, like desperately sick, but somehow still fiercely strong enough to handle a massive surgical procedure.
Now, I was one of the many people who had to face the hard fact that the average wait time is 1.3 years. Living in that kind of limbo, it's really tough. But what happens when that call finally comes? What does your reality actually look like once you cross that threshold of surgery and wake up with new lungs? Well, let's pivot from the heavy weight of waiting into some action and preparation.
Moving right along to Section 2, first steps after surgery.
Okay, so the immediate reality of leaving the hospital can feel entirely overwhelming. To manage it, I broke things down into bite-sized goals based on my care team's guidelines. Step 1, you are absolutely going to need 24/7 caregiver support for those first several months. I leaned on my family for literally everything, from managing meds to running errands. Step 2 is strict incision care. You've got to keep it clean and dry to fight off any infection. And Step 3, pulmonary rehabilitation. I wasn't just sitting around healing, I was actively training my new lungs to work.
This brings us to Section 3, the 6-month recovery timeline.
Now, clinical data consistently points to the first 6 months as the absolute most crucial and transformative period. And honestly, my own timeline matched this perfectly. Right at discharge, you're in a state of pretty high vulnerability. For the first 1 to 3 months, I was at the clinic weekly for blood tests and biopsies, just staying super vigilant about acute rejection or infection. But, and this is huge, as a longitudinal study in the Minaldi Archives for Chest Disease shows, that 6-month mark is where you hit a massive peak in quality of life. The heavy monitoring tapers off, and the real living finally begins.
Let's look at Section 4, measuring your physical comeback.
To prove that the physical grind of early rehab is absolutely worth it, my doctors use 2 main ways to measure my real-world victories. The first is the 6-minute walk test, which is exactly what it sounds like, measuring how far you can walk in 6 minutes. The second is FEV1, which measures the amount of air you can forcefully exhale in just 1 second. And hey, these aren't just abstract medical terms. They literally represent your ability to walk to the mailbox, play with your kids, and just get back to living your normal life. And wow, the data from that Minaldi study completely mirrored my own leap forward. Before the transplant, patients could walk an average of only 142 meters in 6 minutes. But at 6 months post-transplant, they saw an average increase of 272 meters. Suddenly, I found myself walking nearly 3 football fields further than before, completely without losing my breath. It's just a staggering testament to what this procedure can do.
If that's not encouraging enough, a study published in Frontiers in Medicine found an unbelievable statistic. Get this, 94.1% of patients successfully and completely withdrew from oxygen therapy. Let me tell you, leaving those heavy, tethering oxygen tanks behind for good was hands down one of the greatest days of my entire life.
Okay, moving on to Section 5, mastering life at home.
To protect those amazing physical gains, I had to master some new rules once I got home, following guidelines from the Pulmonary Fibrosis Foundation. First off, absolutely no driving early on, just to avoid straining your chest, and no lifting anything heavier than 5 pounds. The dietary rules are pretty tight too. No raw meat, no undercooked seafood, and a strict zero-alcohol policy. You see, alcohol can cause severe liver damage when it mixes with your immune-suppressing drugs. Oh, and strangely enough, I had to be super careful with animals. Yep, that meant strictly avoiding baby birds, chicks, ducklings, and literally all reptiles. No joke.
I've really learned to look at it as a simple trade-off. Think about it.
My old normal was dictated by heavy oxygen tanks, a super limited life, and feeling breathless even when I was just sitting on the couch. My new normal? Well, it just requires vigilant hand washing, wearing a mask in crowds, and taking my daily immunosuppressants so my body doesn't reject the lungs. It's a highly manageable burden, and it's the exact thing that allows me to actually live.
And that leads us to our final section, Section 6, New Quality of Life.
We've talked a lot about the physical metrics and the rules, but honestly, the psychological weight that lifts off your shoulders is just profound. Manaldi data tracked this too, finding a huge percentage of patients reporting psychological impairment before their surgery. But right at that magical 6-month mark, my own psychological distress absolutely plummeted. The everyday terrifying anxiety of suffocating was finally replaced by the overwhelming relief of actually healing. So, here is the absolute crucial point. That Frontier study reported that over 88% of patients regain their independence for daily life activities. Think about that. I didn't just survive. I got my total autonomy back. And I promise you, this doesn't just change your life. It completely transforms the lives of your caregivers and your family too. It's a real game changer.
We've seen the trajectory, the lifestyle hacks, and the breathtaking statistics. The science, the data, and my very own lived experience all prove that the tough climb through those first 6 months is absolutely worth it. So as you continue to wait for your call, keep this exact future in your mind's eye. Are you ready to put in the work, protect your new organ, and take your very first deep breath on the other side? Thank you so much for joining me for this explainer, and I am wishing you immense strength on your journey forward. You've got this.